overworked, overwhelmed. So it is a big thing on social media. You go on there, you see somebody take a picture of their schedule and say, look at what I had to do today. But Dr. Rice, I'm not trying to blow any smoke, but honestly, I don't ever feel that way when I go to work because I can strategically look at my schedule. And regardless if it might be an overwhelming schedule, I can get through that day by modifying it. Did you know that you had the power to modify your schedule as a dentist or a hygienist?
Hey friends, I'm Dr. David Rice. I'm the chief editor at DentistryIQ, back for another episode of Gloves Off with none other than
Candy Velez.
Candy, what's shaking in FLA?
Oh my gosh. Well, we just had a hurricane, but everything looks good. I did lose my tree that I planted a few years ago, so that was the only thing. So we're good.
Good. I'm so glad to hear. Well, listen, we've got another great topic today. And it's something that I know impacts so many people, especially in the hygiene side of the world and young dentist side of the world, you too. But overworked, overwhelmed, your patient schedule. Tell me a story.
Oh gosh, overworked, overwhelmed. So it is a big thing on social media. You go on there, you see somebody take a picture of their schedule and say, look at what I had to do today. But Dr. Rice, I'm not trying to blow any smoke, but honestly, I don't ever feel that way when I go to work because I can strategically look at my schedule. And regardless if it might be an overwhelming schedule, I can get through that day by modifying it. Did you know that you had the power to modify your schedule as a dentist or a hygienist?
I would love to know how to.
All right, so let's just give an example here. So I come into work, my 8 o'clock patient hasn't been to the practice in 4 years. They're on the schedule for their full exam, x-rays, prophy, fluoride. First of all, 4 years, the dentist hasn't even checked them. In the state of Florida, you have to see the dentist every 2 years for a brand new hygiene diagnosis. So when I see that patient, I just know that I'm going to see Mary at 8 o'clock. We're going to review her health history. And if everything is good there, I'm going to get into the assessments. I'm going to let Mary know that, you know, we may not be able to make it through the whole appointment today. I want to make sure that we take good care of her. So if I don't have time to get into her hygiene because something has changed, we will schedule her for another visit.
Okay, I love that. So it's not so much about saying, hey, we're not going to see you today. It's a whole lot more about how we manage our time, prioritize our time. And then I think if I'm hearing you right, like just sitting back and being open and honest, like you said, I love what you said. The state of Florida every 2 years requires you and I to look at a patient and make sure that we're on point with our diagnosis.
Absolutely.
That's big.
It is huge because, you know, if this patient hasn't been to the practice in many years, then who diagnosed that hygiene appointment in the first place? The front desk? I mean, it just doesn't work that way. So in this series that we're doing, this is episode 2, you know, stepping into your power as a provider. This is another way to step into your power. Look at your schedule strategically. And just like you said, it's not about sending a patient away. Let's say we do that with our 8 o'clock patient. And then my 9 o'clock is 20 minutes late. Hopefully we have some sort of systems in place to manage that. But I don't always like to turn a patient away. Let's say my patient got caught in traffic with a car accident. Also, we need to update their exam and hygiene. Maybe I can see them for that exam and utilize their time while they're at the practice, and then we can reappoint for hygiene. Or if the doctor has more time on their side, maybe they can handle half of that appointment for me. So don't get overwhelmed. Just, you know, look at it and make decisions that benefit you and the patient.
So you guys are strategically thinking and communicating throughout the day to almost play Tetris and move pieces around based on what gets thrown at you. I love that. How do you and your dentist work sort of hand in hand to problem solve? Like you just said, patient's 20 minutes late, but oh man, my dentist might have 10 minutes or 15 minutes on their side. So here's what I can do and here's what they can do. How do you communicate that well throughout the day?
So number one, we have our huddle in the morning.
Mm-hmm.
So I'm sure you do have a huddle as well, Dr. Rice, with your practice.
Big
So
fan.
so if we can get ahead of some of these areas where there might be some snags in the schedule, we can attack it at the morning huddle. But even more importantly, I review my schedule 2 to 3 days ahead of time. So that way we can address any issues before the day even arises. But that doesn't always happen when things are put in at the last minute. But that doesn't mean that you have to be overwhelmed and stressed out. Just
Love
work
that.
through it strategically.
I love that. So chance does indeed favor the prepared. All right. So we're getting close to the end here, but let's just flip it really quick. What happens when the schedule blows up?
And what do you mean by blows up?
So
You got to give me an example.
All of a sudden, I don't have a 9 o'clock. My 8 o'clock came in. I don't have a 9 o'clock anymore.
Okay. So in those particular situations, I'm ready to call patients in to fill that particular time slot. However, let's say I'm with my 8 o'clock patient and they need more hygiene treatment. Let's say they were on the schedule for one partial quadrant of scaling and root planing. We can check with their insurance to see if we can utilize their time better and do more in one day. So I might do more in one day with one patient if I have extra time on my schedule. Maybe this patient wants to stay for a whitening procedure and I couldn't do that prior, but now I have time to do it. So these are times that you can really use to connect with your patient and provide some extra services that they're wanting, but you might not have had the time initially.
I love it. I love it. So friends, we're going to schedule to be productive rather than busy, just being busy, but we also need to communicate all day, every day on the fly. Candy, it's always good hanging out with you. Thank you so much for the information you bring.
Thank you for having me, Dr. Rice. It's been a pleasure being here.